Hello, everyone. Thank you so much for joining us today. I hope you're well from wherever you are in the world. But we are all here for the same reason. We want to keep our kids safe. My name is Natalie Drazen, and I am the North American Director and United Nations Representative for the FIA Foundation. And at the FIA Foundation, we focus on the journey that kids make every single day, the journey to and from school. But unfortunately, as you probably know, millions of students are being deprived of their education every year because of crashes. We know that crashes are more than just a threat, but we don't have to wait for them to occur. We can prevent them through data-driven approaches like we'll discuss today. Traffic conflict technique is nothing new, but to my knowledge, this is actually the only tool of its kind specific to school areas. It's available for free because every child should have a safe and healthy journey to school. This tool originated because we heard from partners around the world that they knew crashes, injuries, and fatalities were a problem, but they didn't have the data to show it. And without the data, they couldn't make things safer. Our children deserve better. We all know the feeling of almost being in a crash. That's a traffic conflict or a near miss. Sometimes traffic conflicts are really obvious. There's no infrastructure to protect us, and we're forced to dodge speeding vehicles. But other times they're not so obvious. And this tool is useful even in those instances where we have the data and we've built safer infrastructure. It's counterintuitive, but the infrastructure might still be unsafe. Here's a photo from Malmö, Sweden, where I had the pleasure of experiencing the Swedish winter with our friends and experts at Lund University as they taught me and Doug Railer from CDC how to do traffic conflict technique. You can see this raised crosswalk and it looks safe, right? But actually, the speed hump is far enough from the crosswalk that cars go over it and then speed up by the time they've reached the crosswalk, placing pedestrians and cyclists at risk. So just because you build safe infrastructure doesn't mean that people will interact with it in a safe way. And traffic conflict technique can help you assess that and fix it. So just as you've seen in these two photos, traffic conflict technique can be adapted to a wide variety of contexts. Here in the US, there's significant potential for this tool to make a real difference with the first ever alignment between our national strategy and the global plan of action, both focused on safe systems. That's why I'm so excited that you'll hear from CDC, which will give you an overview of the tool. And then you'll hear from partners around the world from Amend, ITDP, and AIP Foundation. I want to extend a very, very heartfelt thank you to CDC and CDC Foundation, which helped advance global road safety for years and which graciously partnered with us on this project. And I'd also like to thank all of our speakers and their organizations, and to Aggie and Kate at the FIA Foundation, and to all those who worked on the toolkit and implementation behind the scenes for their very hard work and for sticking through it through the pandemic. Together, we've proved that this tool can help save lives in contexts we really couldn't have even imagined. So today you'll see that there is significant opportunity to grow and to scale this. And that's why we're glad that you're all here. We hope that you're going to ask the hard questions and also be inspired to use this technique yourselves. So I'd like to turn it over to Jen Swanson at CDC, who helped create this toolkit and write the paper showing that it works. And I'd also like to thank Doug Railer and Aaron Sauberschatz at CDC, who helped turn my crazy idea into reality, and without whom this really would not have happened. So Jen, take it away.
All right. Good morning, good afternoon, and good evening. My name is Jennifer Swanson, and I will be presenting our work on the Traffic Conflict Technique Toolkit, a project I worked on while I was a CDC Foundation field employee. All right, I have no conflicts of interest to disclose, and I just wanted to mention that funding to develop this project was made possible by FIA Foundation through the CDC Foundation. Throughout this presentation, I will provide background information and data on the global burden of road traffic injuries among children, describe the pedestrian vehicle traffic conflict technique, which I will now refer to as TCTs, and present results from practical application of the methods in school zones in Ghana, Vietnam, and Mexico. So to provide some context, globally there are 1.35 million deaths and 20 to 50 million non-fatal injuries each year as a result of road traffic crashes. Among people aged 5 to 29 years, road traffic injuries are the leading cause of death, and low and middle income countries are disproportionately affected. Pedestrians are particularly among the most vulnerable road users, and even further, pedestrian children are at highest risk. More than 500 children die each day, and about 10 million children are injured or disabled as a result of road traffic crashes annually. Lastly, it is estimated that 3,000 or more children are injured or killed on roads daily, often on the way to school, demonstrating that the route to school is particularly dangerous. So first, we must define a traffic conflict. A traffic conflict is an observable situation when two or more road users approach each other and risk colliding if their movements remain unchanged. An important aspect of this definition is that the road users are on a direct collision course and risk crashing if one of the road users does not take evasive action and change its trajectory. So just as Natalie mentioned, another way to think about traffic conflicts is as near misses. So traffic conflicts are studied to identify hazardous locations and to focus on prevention. In this case, the focus is narrowed to school zones. Usually when there is interest in learning if a particular intersection or stretch of roadway is unsafe, crash data is used. But crashes are rarer than conflicts, and sometimes evaluation using these types of data sources requires several years of crash data and multiple sources. And in addition, crashes are often underreported and lack severity data. Therefore, we focused on the pedestrian vehicle traffic conflicts in school zones, which are traffic conflicts between non-motorized student road users and motorized road users that occur in and around primary and secondary school zones in low and middle income countries. Traffic conflict analysis allows for proactive data collection to prevent crashes and injuries before they occur, and allows for relatively quick and timely evaluation of traffic safety. In the toolkit, we collected observational traffic conflict data to evaluate the safety of intersections or roadways. Studying traffic conflicts helps decision makers decide which road safety interventions to implement, and also to determine the effectiveness of interventions in reducing traffic conflicts among student pedestrians and vehicles. So to accomplish this important work, we developed a traffic conflict technique toolkit, which describes how to collect and analyze traffic conflict data. The toolkit aims to provide technical assistance to low and middle income countries on how to apply TCTs in areas of concern and how to evaluate the intervention's effectiveness. We provide a menu of TCT methods that can be adapted based on the local situation. The TCT steps begin with assessing existing road user risk, and then progresses to collecting and analyzing traffic conflict data to inform the selection and implementation of road safety interventions. The suggested timeline to complete all 11 steps with fidelity is 8 months. And while all of the TCT steps are important and must be implemented in order, I will provide further details on the following 7 steps. Step 2 is decide which TCT method to use. Step 3 is conduct data collector training. Steps 6 and 9 are to collect pre and post intervention data. Steps 7 and 10 analyze and interpret the data. And step 8 is select and implement the road safety intervention. So information collected in step 1, which is the completion of the road safety assessment, can help determine which of the 5 TCT methods to choose. Another important aspect of choosing a method is to consider the traffic flow of the local situation to ensure maximum effectiveness. And as you can see, these 3 photos have varying traffic flows. So it's just important to tailor each method to the local context. So each of the 5 TCT methods has been appropriately adapted to account for pedestrian vehicle traffic conflicts. In the toolkit, we do provide a list of criteria to consider when deciding which method to choose, along with detailed information on each method and the tools to use to collect the data. The criteria ranges from ease of use, required road safety experience, human and financial resources, and provides unique benefits and limitations to each method. Throughout the development of the Traffic Conflict Technique Toolkit, all 5 TCT methods were piloted in various locations. The pilots provided invaluable information and feedback on various aspects, such as the utility of the data collection forms, the additional training required for a complete understanding of each method, the importance of data collector objectivity and consensus, and the benefits to understanding conflict types and severity. So step 3, which is conducting data collector training, is perhaps one of the most important steps in the toolkit and should be implemented with fidelity. Data collectors play a critical role in traffic conflict studies. Therefore, assembling and training a skilled data collection team to be reliable, objective, and consistent supports the quality of results. The length of data collector training depends on the TCT method chosen and can range from 2 to 5 days, with more time necessary for the data collectors to be trained on the more complex methods. I included an example of the 5-day training schedule that I followed in Tanzania. And during training, it's important for each data collector to attend each day for the entire day so that no material is missed. And the data collector training can include TCT information, practical instructions, training on previously video recorded conflicts, and real-world pilot data collection, along with standardization of the processes that the data collector should follow. A refresher training can also help ensure data quality if a significant amount of time passes between data collection periods. So step 6 is after selecting a data collection site and collecting a baseline road user count, which are the preceding steps, we are ready to collect pre-intervention traffic conflict data. So these data are compared to the post-intervention data, and the process of data collection should be standardized and objective. Collecting data for 1 to 2 hours per day in the morning and in the afternoon over the course of 5 days is ideal. This is to capture any irregularities or fluctuations in traffic flow. Improving data quality can be done by using video recording during data collection and reviewing the video with team members to determine how to handle possible data inconsistencies. Data analysis and interpretation will inform which road safety interventions are selected and implemented, and choosing the same analysis approach for both pre- and post-intervention data analysis will ensure consistency throughout the TCT study. In the toolkit, we present 2 approaches to analyze traffic conflict data, which can be tailored based on the local context. Approach number 1 provides the traffic conflict rate per 1,000 vehicles, and this is the method that we used in the toolkit, in the publication. And approach number 2 provides the percent of traffic conflict types among all conflicts. So community engagement prior to selecting and implementing an intervention can help ensure adequate acceptance. And this can be accomplished through the establishment of a road safety committee. Planners might also want to consider how widely publicized the interventions should be and when to announce the planned changes. Interventions could focus on a number of traffic calming strategies and can be determined based on the data. Post-intervention data collection occurs at multiple points in time, ideally 1 month after the implementation of a road safety intervention, as well as at the 3 and 6 month mark. If post-intervention data are collected too soon after intervention implementation, the road users are likely to be more cautious and this might skew the data. Post-intervention data collection also gives the most accurate comparison if it occurs at the same time of day and same days of the week as the pre-intervention data collection period. So now I will transition to the practical application of the 3 TCT methods that we used in Ghana, Vietnam, and Mexico from 2019 to 2021. Each partner took the time to plan, implement, and execute all 11 steps previously outlined. And on this slide, I highlight the site location and unique infrastructure changes implemented at each site. So Amend in Ghana installed a number of physical infrastructure changes, as well as reduced the speed limit and provided road safety education. AIP Foundation in Vietnam installed flashing beacons and school zone warning signs, as well as constructed 2 refuge islands for pedestrians and painted traffic calming markings. And ITDP in Mexico implemented sidewalk extensions, painted crosswalk markings, and installed bollards to separate the pedestrian vehicle areas. And I'm excited to hear more from each partner in the subsequent presentation. So this table shows the comprehensive results from all 3 sites. Between pre and post intervention data collection, the number of traffic conflicts, as well as the traffic conflict rate, decreased at each site, illustrating that the infrastructure changes had the intended effect to improve road safety. Results of conflict severity from the post-intervention data collection period gave mixed results, which indicates further study is needed on how to achieve objectivity when observing severity. So we determined that TCTs can help decision makers select and evaluate road safety interventions. All 3 sites demonstrated successful application of the TCTs in varying geographical, cultural, and road safety settings, and achieved timely evaluation of the impact of the infrastructure changes. Since the study spanned 2020 and into 2021, we did experience some delays in data collection between the pre and post-intervention periods at one site due to the COVID-19 pandemic. And in subsequent studies, it is important to dedicate time to training and practice to achieve data collector consistency and objectivity when estimating conflict severity. This can be difficult to achieve because of the differences in personal perceptions of risk, but ensuring adequate and comprehensive training can limit subjectivity and improve data quality. So we concluded that this evidence-based road safety resource can help improve road safety and make the journey to and from school safer for students, ultimately preventing injuries and saving lives. And we provided the linked manuscript for further reading. So I just wanted to quickly acknowledge Natalie and Aggie from FIA Foundation, the wonderful partners in Tanzania, Ghana, Vietnam, and Mexico who contributed to this project, and to the additional individuals who provided guidance and support in the writing of the toolkit, along with Aaron Silverschatz and Doug Roller from CDC. And thank you all for your attention, and I will now turn it over to the next speaker.
Thank you so much, Jen, and thank you again for your hard work in making this happen. I just want to reiterate briefly Jen's really good point of how important it is to have the right period of time between intervention and then post-intervention follow-up and monitoring. Because again, as you know, you might build a safe infrastructure, but people will modify their behavior. They'll interact with it safely at first, but then a couple months later, they might revert back to what was going on before or change to another unsafe behavior. And this is really a tool that can help you ensure that people are interacting with infrastructure in a safe way. So thank you again, Jen. And now I'd like to turn it over to Simon at Amend, who piloted the toolkit in Africa. Amend has been our very long-time partner in the region, and CDC actually helped show that their work around schools decreased injuries by 26%. So their collaboration is nothing new, but we are very proud to build upon it. Simon.
Wonderful. Thank you, Natalie. I will share my presentation as well. Yes. Good morning, good afternoon, and good evening to you all. My name is Simon Kalola. I'm a Tanzania country manager for Amend Tanzania. Amend is an international road safety NGO that works to prevent road safety and road traffic injuries around schools, and mostly focusing on vulnerable road users. And today I'll share with you our experience after conducting various assessments as part of the toolkit that was done in Tanzania as a training, and then the assessment was done in Accra, Ghana. So AMEND has offices in Ghana, Accra, Mozambique, in Maputo, and Dar es Salaam, Tanzania, where I am based. And most of our work, which is implemented across the African continent, basically focuses on a number of areas, risk areas. But today I will specifically focus on the school area road safety assessments and improvements around school, where the toolkit was essentially used as part of our assessments. So safe school zones, these are part of the interventions that AMEND's road safety assessments and improvements program, as known as SALSAI, was implemented. And this has been actually implemented in more than 9 African countries, with key interventions including safe school zones, 30 km/h speed limits, speeds, improvement of speed humps, pedestrian crossings, and footpath being the interventions that are put in place to improve safety around these areas. But fundamentally, to conduct these assessments as part of the project, we very much involve key members of the community, but also the local government authorities, as well as our technical team of engineers and community social experts who together work to come up with very specific interventions that improve safety around schools.
Hey, Simon, sorry to interrupt. Just quick thing, you might want to put on presenter mode. We'll see your slides a little bit better. Thanks.
Okay.
Because right now we can see your notes. Yep.
All right.
Maybe if you hit use slideshow, there you go.
Can you see that?
Almost. There you go. Click on that. Use slideshow. Right. There you go. Thank you so much.
Fantastic. All right. So to go back to the traffic conflict techniques as the toolkit, AMEND in Ghana, Accra, we piloted the Institute of Highway Traffic Conflict Technique, IHTCT, version 1. This was done at Oblogo cluster of schools. This is one of the schools in Ghana where we have implemented our safe school zones project. And it's one of the areas where, based on our experience and our previous projects, was seen as the one with a lot of conflicts and high risk of road traffic injuries among road users, particularly school-going children. And therefore, what was done at this school back in 2020, we conducted the road user counts and traffic counts around the school area, where 3 of our data collectors were involved after going through a thorough training, a training that involves, as Jennifer insisted, that training is essentially a key part of the toolkit based on our experience because of the elements of subjectivity and to have a very consistent information coming from the collectors on the ground. And after the training, of course, the pre-intervention data collection which took place, this was just before the pandemic, where we spent about 3 days on the ground with our team collecting the data around the school. And then immediately after that, AMEND, together with the partnership with the FIA Foundation and of course CDC and CDC Foundation, we came up with very specific infrastructure improvements. And these were part of the results from the pre-intervention data that we collected, but also fundamentally the community member consultations, which actually are conducted around schools. And this actually involves speaking to children themselves, teachers, members of the community, folks selling items next to the school who actually see the risks on the daily basis and are part of that environment as they interact with vehicles in the daily basis. And then another key component as part of these infrastructure improvements were to involve the local authorities, local engineers to discuss the interventions that we suggested, and then of course for them to give us the approvals to go ahead and put these infrastructure interventions in place. As I said, we look at speed humps, pedestrian crossings, footpath separating pedestrians from the vehicles, so that at least we know once these improvements have been put in place, the risks have significantly reduced, as we'll see in the next slides. And then once we finished the infrastructure improvements around March, we were waiting, as Jennifer said, we were waiting for a few months before we went back to collect the post-implementation data. But of course, because of the pandemic, we had to wait for a little bit longer for us to go back and collect the data. And this somehow, as you'll see in the next slides, affected our overall data collection process as we had initially intended. And to talk about the results and the usefulness of the toolkits, based on our experience, this was quite interesting because as part of our interventions and part of our school area of safety improvement project, we have a number of assessments that we conduct, including speed surveys, traffic counts, pedestrian counts, interviews with members of the community, as I explained, but also we normally conduct mode of transport survey, simply to understand how children travel from and to school. And also we conduct an assessment called catchment area survey, which basically help us to understand where specifically are these students coming from in relation to the school itself where we're implementing the project. Therefore, one key point that I need to point out now is that to select a school where we're implementing our SASI project, basically rely on anecdotal data from the school, but also the local government suggesting that perhaps school 1, 2, 3, 4 have a high risk, and then we send our team on the ground to assess these areas. But sometimes you find that there's no data to tell you how many injuries, for example, were recorded in the last 12 months around that school. And that could mean that perhaps the risk is low, but when you go further and think about the risks and the exposure that pedestrians, particularly children around that school, are exposed to, the exposure is high. But this is where I personally saw the importance, the usefulness of the toolkit, because it helped us to go a little bit further beyond just the anecdotal data that we get from the schools and school administration. And this helped us really to see the level of risk and the exposure and even the severity of potential injuries that could be sustained at around school. So this was fundamentally very important for us to make a case to the local government officials who actually are very vital in providing the support when you're implementing our Safe School Zone project. But also we know that it's a very simple tool that can be used by a small team or small organization across the world that can actually take these fundamental the basics of the toolkit and then pilot based on their local context. And for us, for example, it was very important to understand how pedestrians interact with the vehicles around the school beyond just what we could hear from members of our community and our speed data, for example. So I want to highlight that as a very important point to take out of the toolkit. And lastly, I want to discuss about the challenges and solutions that we face. Of course, I've mentioned about the COVID-19, which caused a lot of delays between the implementation of the infrastructure improvements and then going back to collect the post-implementation data, which to some extent, based on this slide here, we saw the rates post before the interventions. When we collected the baseline data, what we saw was that about 21.5 conflicts per hour per 1,000 vehicles around that school, that cluster of schools. And then post-implementation, when we put our interventions in place together with the local authorities, we collected the data and found that there were only 16.7 conflicts per hour per 1,000 vehicles. But again, I want to say that this took place about 10 months later due to the COVID-19 pandemic. Therefore, the lessons from the experience in Ghana, in Accra, is that the training is essentially a key part of the toolkit. I think without for you to implement this toolkit, to use it in your assessments, you need to do the training, make sure that your team are very well trained, so that to eliminate elements of subjectivity and disparate interpretation, as Jennifer clearly explained. But also that one thing that we found out to be very useful in our case was the use of camera and recording the video footages, which were later used to review the conflict and ensure that the data that we submitted for analysis had the quality and the credibility that was required. Thank you so much.
Thank you so much, Simon, and thank you for that really good point about reducing subjectivity as much as possible. Having the same people do the pre and post evaluation and go through the training, I think, is really key to doing that. So now I'd like to turn it over to Berenice from ITDP, who will present on both Mexico and Costa Rica. ITDP has been a leader in regional collaboration and has grown Vision Zero for Youth, which originated here in the US, in DC, where I am, all the way to Latin America. Berenice, take it away.
Thank you, Natalie. I am going to share my screen. So give me a second. Yes. Can you see it? Okay, so hi everyone. Thank you, Natalie, for inviting us to this webinar. My name is Berenice Perez. I am an active mobility and street design from ITDP Mexico. ITDP Mexico is a non-profit organization that promotes active mobility as well can buy. And in Mexico, we had more of 50 years. We are working with governments and also with other countries about the promotes the urban mobility. So I am going to talk about first about this case of study on Puebla de Zaragoza in Mexico. But before, I want to give some context about the road safety. In Mexico, the roads insecurity is a public health problem. Mexico is ranked in the 16th position worldwide, and the second in Latin America as the country with more deaths caused by traffic accidents. Every year, nearly 16,000 people die as a result of traffic accidents, and more than 100,000 get injured. It's also an equity problem because of the impact of vulnerable groups. Traffic accidents are one of the 10 main causes of death in Mexico, and the second cause in children's death between 5 and 9 years, and teenagers for 10 and 19 years. Finally, it's also an urban problem because 60% of deaths occurs in urban areas. So how can we measure preventively the safety in the school zones? By implementing the TCA methodology, we work since 2016 with the FIA Foundation in the application of Vision Zero for Youth. With this integral public policy that wants to get to zero deaths and injuries caused by traffic accidents, especially in school zones. We work with the FIA Foundation and CDC to adapt this original methodology to our context. So we start to implement this methodology in 2 schools. First in 2017 in the high school called Moisés Sáenz that is located in Mexico City. And also we work in 2019 with Puebla in the Benemérito Instituto Normal del Estado that have different levels of grades that go at elementary school to university. So in this case, I am going to focus in this Benemérito Instituto that I am going to call like BINE. So this school has 9,000 students at different levels from elementary school to university. We analyze the most conflict intersection around the school that is located between Hermano Cerdán Boulevard and 37 North Street. We work with the Secretary of Mobility of Puebla, and they give us this intersection because it's considered the most conflicted in the state. We can see the intersection analyzed in the blue point in the picture. So in this slide, we have some pictures about the original state of this intersection. We can see that was an intersection unreadable and safe for the general people, but specifically for children. This intersection didn't have a traffic light and horizontal signage to identify the pedestrian crossing, and the conductors drove very fast, more than 60 kilometers per hour. So what was our baseline about this analysis? We work in 4 phases. The first was that we observed and registered the traffic conflict at speed inside. Also, we reviewed the videos in our office and compared the data obtained inside. We digitalized the collect information in videos and inside. And finally, we analyzed the results. We work in 2 moments, in 2 times, before the intervention, in 2 normal days, specifically in October 2019. And we work again after the intervention in the same 2 normal days, both in January 2020. So we work the analysis in 2 schedules. In the entry and exit of the first school period, it's important to say that in Mexico, we have 2 schedules for our children, one on the morning and other at afternoon. So in this slide, I have a video. So I am going to start the video and tell me if you listen it. But please put attention in every moment of every user. So I think that this video is a little rude, but it's important that the people can see the kind of conflicts that we identify in this intersection. So this is dangerous, specifically because children and adults are walking in a normal speed in the intersection, but the driver that comes to the central line continuously turn right and high speed to gain a passage to trailer. So this is the kind of conflicts that we identify in this intersection, and it's sad to see it. So the next. So what happened? In our first analysis, we have 147 conflicts identified between pedestrians and bicycle drivers. Of the 10 were serious. This diagram tells us about the severity of the traffic conflicts observed. Also, we had that 62% of bicycles involved were private cars, and the most frequent conflict identified was in the school exit times, as 1 to 2 p.m. more or less. And also we have, we identify 32% of pedestrians run to cross the street. So what happened with this data? We talked with the Secretary of Mobility of Puebla, and we present this information. So then they redesigned the intersection and implemented it in November 2019. So we can see that the Secretary of Mobility of Puebla makes some changes in the infrastructure. So they put this cross-making and they gain a space for the pedestrians and put these bollards that separate the pedestrians to bicycles. So it's important to say that this methodology don't give us the measures to implement this kind of design, only give us the data, and this helps us to understand the movements that happen in this intersection. And it's important that the designers teams that every direction gives this proposal. In this case, the designers team of Secretariat of Mobility of Puebla give this proposal. Only we check it and give some recommendations. So then this intervention, we returned to Puebla 2 months, sorry. We returned in January 2020. So we identify conflicts, that means 69 reduction. Also, we identify further improvements as speed reduction in social driving lanes and activity of crossing times for pedestrians. So also we made this report that you can find in this QR. So if everybody wants to check it, please take a photograph of that. About other actions, after this experience, we started working with more Mexican authorities. For example, we work with Monterrey in Nuevo León, with the Secretary of Sustainable Urban Development in 2022. We work with them in some trainings, and now they are looking for the implementation or the opportunity to implement this methodology in their context. Also, we are working with Zapopan, Jalisco, that is other state of Mexico. We work with the Department of Mobility and Transportation in 2023. Now they are applying the TCA methodology in only one intersection. So now I am going to talk, yes, I am going to talk about Costa Rica, about this experience. It's in general because Costa Rica is analyzing the data that they have about this application of the methodology. So what happened in Costa Rica, we work with the Costa Rica Road Safety Council, that is called COSEBI. They work in 2 phases. First, they apply this TCA methodology in 20 intersections, 7 of which were near schools in different districts, specifically in Barranca, El Roble, Chacarita, and Punta Arenas. So COSEBI applied this methodology during 7 days in 6 slots for 1 hour, with the help of cameras inside. It's important to say that COSEBI didn't go to the site to identify the traffic conflicts, but they use the cameras for the times that they have this analysis. So what happened then? With this data that has COSEBI, they implemented tactic urbanism, but only in 4 zones. They implemented it in October and November 2022. They have the participation of the schools and the people that lives around these spaces. And it's important to say that this space is considered as cycling village. In Mexico, we say that is a pueblo bicicletero because the children start first to ride in bike, that's walk. So yeah, it's very was very important to visit these streets. We went to Costa Rica the last week with the FIA Foundation for observe these kind of movements and the interventions that they did in this moment. So in other information is that, for example, in 2020 and 2022, we and COSEBI training local company that implemented the TCA methodology in these training intersections. No, we work with the COSEBI to have these workshops with the local company. We make a methodology to learn this traffic conflict analysis methodology. So it was very useful for us, also because we start to be experts in the topic. Also, in November 2022, it's important to say that the tactical urbanists, what implemented 1 week after the implementation. This is because Costa Rica have a limit that comes to the infrastructure dependence. They need to put the tactic urbanists, but then yes, they remove these interventions. And it's also is important saying that we are working with the COSEBI in the TCA guidelines, but specifically for Latin American cities. So we are working on it, and we hope that this technique can get more cities in America. So it's all for my part.
Thank you so much. I really appreciate your work in both of these countries. It is impressive. Now we will also turn it over to Daniela from ITDP, because ITDP, of course, works throughout the region, and she will tell us more about their work in Brazil. Daniela. I know Daniela is having some issues with power at the moment, so perhaps we should skip and come back to you. We can go over to Nhung at AIP Foundation, which helped pass Vietnam's universal helmet law that saved 17,000 lives and $4 billion in its first 8 years. They work at all levels of road safety, as you'll hear more about. So please, AIP Foundation, we'd like to turn it over to you.
Okay, thank you, Natalie. So just a moment so I can share my screen. Okay, so hi everyone. My name is Nhung from AIP Foundation. First of all, I would like to say thank you to CDC and FIA Foundation for organizing this webinar and for inviting me to the webinar. So today I'm going to share about how AIP Foundation applied the traffic conflict technique in the context of Vietnam, particularly in one of our projects, which is the Safe School Zone Guide project. Before that, I would like to give you a brief introduction about AIP Foundation. AIP Foundation is a non-profit organization dedicated to reducing road traffic fatalities and injuries in low and middle income countries. We have offices in Cambodia, Thailand, and Vietnam. And we also have like some ongoing project in India, the Philippines, and Myanmar. So going back to Vietnam, There are over 17 million students in Vietnam from primary to upper secondary level. They are exposed to different traffic risks while going to school every day. And you can see on the screen here, every year Vietnam loses nearly 2,300 children on the road. And road injuries are the second leading cause of deaths for children between 5 and 14 years old. So in response to this crisis, in 2021, the AIP Foundation initiated a project which aims to improve road safety conditions for students in school zones on a larger scale. So this project is meant to improve the policy and procedure framework for school zones in Vietnam by having the government establish a set school zone guide for schools, all the schools in the country. To do this, AIP Foundation has been working with the Ministry of Transport and other government partners to first develop a nationwide safe school zone guide, which outlined the infrastructure standard for safe school zone. And then we did a pilot. Of the safe school zone guide in order to improve the road infrastructure for the school zone in 3 school cluster in 3 provinces. You can see here, the first one is Hanoi, and then Nghệ An in the center, and Sóc Trăng in the south of Vietnam. As part of the program, so we installed the crossing, the school zone lights inside, and also a 30 km/h speed limit size in the school zone. And after securing the government approval, we will also organize the trainings for like the official from all the Department of Transport from all 63 provinces on how to use the guide to upgrade the school zones. One of our big milestones is that like in September 2022, the Ministry of Transport issued the first edition of the guides as a legal reference document. It is a helpful resource for local authorities to assess and implement solutions to improve traffic safety conditions in the school zones. The guide was developed for not only the government, but also for the schools and other practitioners in the field who want to upgrade the school zones as well. However, road safety data is not always available, especially for small and isolated areas like school zones. That's why the traffic conflict technique provides a solution for collecting data to evaluate the safety of a school zone for the schools and the practitioners to utilize. In Vietnam, we use the method number 4, as the traffic in Vietnam fits into both the categories of steady care pedestrians and effective shared space, which means that like the vehicles can either travel freely at a steady speed at the time of interaction with pedestrians, or at a very low speed or even stop due to the high traffic flow at the time. As you can see on the screen now, there are 3 different criteria used in this method. The first one is change in the speed, the second one change in the direction, and the last one, the vehicle accelerations. In the set school zone project, in addition to the traffic conflict technique that is used to evaluate the effectiveness of applying the guide to improve the infrastructure, in reducing the number of conflicts between pedestrians and vehicles, we also use other assessment tools as well. The first one is the starting for school to evaluate the infrastructure-related risks that the children exposed at the pilot schools. We also did the student crash surveys to measure the number of crashes happening among the students at the pilot schools. And we also did the focus group discussion to gather feedback from students, parents, and teachers on the road safety conditions in the school zone after the interventions. As the guide was piloted like in 3 different provinces in 3 different geographical regions in Vietnam, like the north, the center, and the south. So we decided to recruit the local people and train them to become our field data collectors, so that they can help us to do the video recording at the schools. The field data collectors went to the school to record the videos in 5 consecutive days, from Monday to Friday, and then they send the video back to AIP Foundation for analysis. And I think you can see on the screen here all the advantages, all the benefits that we think of using this technique. Actually, Simon from Amen already mentioned all of these. The first one is about because we use a video method, so we could capture very objective and reliable data, which that the cross surveys or other self-reporting methods can do. The technique is also very simple and pretty cheap compared to hiring lots of people to do a surveys. And moreover, these techniques also provide, we consider indirect indicator to assess the impact of the project. Normally, it takes lots of time and resources to gather road traffic injury and fatality data, but with this technique, we can inform, we can do kind of a quick judgment about the potential impacts of the intervention that we did. And here you can see some result from the pilots that we did with 3 school clusters in 3 provinces in Vietnam. So after intervention, in Nghệ An and province, in Nghệ An and Sóc Trăng province, saw a decrease in the traffic conflict rate between the pre and post intervention. The result of this. And in the slide here, you can also see the result from the star rating for school. So we want to say that the TCT result are quite consistent with other assessment that we did. And it supports the conclusions that applying the guide that we developed can help to improve the infrastructure around the school zone. And here are some challenges that we encountered during applications of the TCT in Vietnam. Firstly, in terms of the equipment, because we use the field data collector, and they use their phones, their smartphone to record the videos. And not all of them have adequate storage in their phone to save the videos. Hence, they reduce the video quality when they do the when they record the videos. That's why on the first day we found out that the quality of the videos was not really good, and we asked them to increase the resolution, video resolutions, and it led to another problem, which is that because for 1 hour video it's really heavy, and it's really difficult for them to upload the videos and share it with AIP Foundation. So to address this challenge, this problem, we had to provide a Google Drive account for them to store the videos, and we also encourage them to upload the video daily. The second challenge that we encounter, which is the changes in the camera angles between the pre and the post. We found out that it's not happened to all of them, but we found some cases that the pre-camera angles a little bit differ from the post. For example, it could be a bit higher, a bit lower, or a bit wider or narrower. They all affect the results a little bit. So in the next phase of the project, we're going to scale up the guide to implement in 10 schools nationwide. So to ensure the consistencies between the pre and the post data collections, we think that like we suggested that, and we're going to do that. Like we will have the same data collectors for the pre and the post, and also like another way to minimize those kind of like risk, we need to conduct the very careful training for the data collectors on, for example, like how to choose the data collection in the field, in the school zones, and how to set the camera angles to ensure the similarity, the consistent between the pre and the post data collections. And as the others, like Natalie and others also mentions about the road users, they might change, they might adjust their behaviors after a while. That's why we have another recommendations about like we should conduct the traffic conflict technique assessment frequently. First, to reassess the traffic risk in the school zone, and second, to evaluate the effectiveness of and the sustainability of the interventions that we did. Thank you so much. And that's it from me. Thank you.
Thank you so much for that wonderful presentation and for all of your hard work. You made a really good point about how video can complement this tool. And I see that Martin in the chat also mentioned the good point that video can't provide the contextual qualitative data that human surveyors can collect. I agree, and Young, you showed how the two can work together. Zaytun also asked if the presentation will be shared. Yes, this is being recorded. It will be on our YouTube channel, so you can look at the presentations in more detail. And please feel free to put questions in the chat as we go. We have one more presentation, and then we are going to open it up for question and answer. So Danielle, I know you've got your power back. Glad to hear it. So please feel free to go ahead and share with us what you've been doing in Brazil.
Thank you, everyone. Sorry for the technical problem. It's not very common here. I guess I was lucky today. Can you see my screen, the full screen?
We just need to have it in presenter mode, and then you're all good.
Oh, it's not. Oh, wait. It was already in presenter mode. Give me a second then.
Sure.
Okay.
There you go.
All good?
Thank you.
Good.
Yep.
Thank you. So hello, everyone. I'm joining you from Rio. I'm Daniele. I work as Active Mobility Manager at ITDP Brazil. And I'll be talking about the Safe Route to School program that we've implemented here in Rio in collaboration with the City of Rio and the FIA Foundation support back in 2021. And I guess we are all actually in one step behind of the presentations we've seen so far, because we use the TCT technique more as a capacity building tool rather than really a data collection and evaluation. So I'll talk a little bit more about that. So ITDP, I guess you're all, it's already the second presentation. So we are located here in Brazil. And traffic crashes are the main unintentional death cause for children in Brazil. Okay, we every year about 32,000 people die in Brazil in our roads and streets. So it's a big number. But we are still not in the system safe system paradigm shift. We still think that mainly, I guess, if you go to the cities and talk to people, normally people think that the behavioral factors are the main issue. We really haven't incorporated the idea that infrastructure quality and design is also important when you talk about road safety. And in Rio, it's not different. And we know that for more 40% of the students in the real public school system, they walk to school, especially in low-income areas. And this is the reality where you were working at. And since 2008, the city of Rio has a traffic education program with a slightly broad focus that is not very common in Brazil, but it's called On the Way to School. And in addition to behavioral issues, this program has always sought to incorporate elements of the safe systems approach. Okay, so, and they call the teachers, with the participation of teachers and students, the program has been trying to link traffic education with the appropriation of public spaces by the school community, and always trying to involve them in the real transformation of that area. So teachers are instructed to prepare together with the students a road safety assessment of the school area, generating what they call it a risk map. This is one of them that you see prepared by the children. And so the children identify the points where they feel unsafe, and they can also propose solutions. So back in 2021, we came in to help to improve this program, because although the final objective has always been to achieve the implementation of road safety improvements in the school areas, by 2020, out of more than 600 schools served with the program, many had like a crosswalk installed in front of, like only a handful, like I guess between 5 and 10 had like more significant pedestrian improvements in the area. So we came in to help improve the program so they could more easily reach the final goal that was really transforming the urban environment and turning the streets around the schools more safer for children. And we did this through a pilot initiative, which was conceived. It was a pilot initiative conceived as a tool to sensitize a group of 15 coordinators or borough coordinators, people that are really working on the field of the traffic engineering company. And we did that through 6 workshops with this group. Okay, so the workshops were like, they ranged from field inspections and like the training with the TCT technique to the project development. Okay, so we didn't have a lot of time. We had like one afternoon to talk about the TCT and other methods. So one training session and one field session. There were 2 afternoons. So it was a very like a quick experience, but we managed to present them a series of different tools that are able to tell you, to give an idea of what the safety of that area. So one of them was the TCT, which chosen the gear method, the first one, because I'll talk more about that because it's the simplest and it's the one that was more adequate to our context at the moment. We also run an assessment with the school ratings for school, star rating for school, sorry. And we also added some additional walkability measures from a walkability index we had here in Brazil, complementary public space observation. So we adapted the Zagir form, we translated it first, right? So, and we also added the type of vehicle, so they could evaluate that. And what was our context and why did you choose that? Because we had a group with little road safety experience. We had low financial and low human resources available. It's a small team at the agency, and they are always overwhelmed of work. So we don't manage to get them like a full week to training, for example. So it's very limited amount of time and personnel available. Okay, so that and we adapted some of the conflicts as well to the reality. This is a video just so you can have a glimpse of the reality. And we actually selected a couple of videos on the web, and some of we managed to do some in the field to show them what the conflicts were. This one was focusing on this guy here trying to cross the street, but you can see like there are people, like it's a very conflictive area. Oh, sorry. And this is another one. So we're talking of a low-income area with little or known street sign and street pavement marks. And it was very interesting to see that we managed to get the group look at the pedestrian, which they are not used. Two, they are normally focused on the car. So I feel like the most valuable, the most positive outcome we had at that moment using the tool as a capacity building was really make them focus on people and not only on vehicles. Okay. And this is the additional observations that we did. Like it's all in Portuguese, sorry, but we all we checked the paving, the garbage that was around, the lighting, shades, and more like a streetscape analysis. And we managed to implement a pilot in intervention that was back in December 2021. Okay. And we got the project got a lot of attention in the city. And they started to replicating it, I guess, in March 2002. Yeah, I guess March. And we implemented it in December, and in March or April, they had already the first first replication. And for that reason, also, we didn't manage to go back and do the post analysis, which we were still planning to do. But as we implemented it in December, so we came the summer vacations for the schools were closed between January and February. So, and in March they decided they were doing the first replication. So like the team was all like very focused on this first replication. So we never managed to go back and do the post assessment. But we are now already in the program gained a lot of visibility in the city, like a lot of people are interested in it, and they managed to implement 18 interventions in last year. They added new staff to the program, and they are now planning to implement another 20 additional interventions this year. And they are still not doing the data collection before and after. But in this afternoon, I have actually, we are still supporting them, and we have a workshop to analyze to understand how the program is going, what looked to last year, and see what can still be improved. And I hope the data collection comes up, because they really, what they say is they are really short-staffed to keep doing or to do data collection. But I hope we're still managed to do that, to add that into their systematic routine. And at least for this next implementation, they are going to start doing a baseline and using the conflicts. Part of the conflicts, though, they were incorporated to the survey that is made with the teachers and the students. They receive a form to fill, and they managed to add some of the conflicts as examples there, so they can check what they normally see in the field. But we haven't managed to make them do like that systematically yet, but I hope we are there. We are in this direction, and I'm very happy to see how we all guys are using that. So it's a great inspiration for real. So, thank you.
Obrigada to you. So now we will turn it over to question and answer, and we've got about 15 to 20 minutes for that. I already see some great questions in the chat. So I will ask our wonderful panelists to come back on the screen and we can go through these good questions. I want to start with James, who asks a very good question. He says, I'm working with a Native American community in Western New York, here in the US, to improve walking and cycling opportunities. But the one thing we experience is that these prospective users are now using vehicles for mobility because of perceived and actual safety concerns. So potential conflicts are skewed because of this suppression. I'm wondering if that's something that any of you have faced, particularly post-pandemic, when people were walking and cycling a lot during the pandemic and then perhaps got back into their cars. How did you address that? Do you have any advice or thoughts for James? That's one question. And I'm going to pose two at a time just so that we can kind of hear from everybody. The other question is, what do you think accounts for the increase in safety ratings despite the conflicts remaining steady for the study schools in Hanoi. And so that's primarily for AIP Foundation, but I think that all of you can probably speak to that, and particularly how star ratings and conflict analysis complement each other. Also for our guests, for those of you who are not familiar with star ratings for schools, I highly suggest you check it out. We can put it in the chat. It is a product by our partner IRAP that allows you to assess the safety of infrastructure around schools on a 1 to 5 star scale and then make improvements. So let's see, could I start with AIP Foundation, as that was a very specific question for you?
Sorry, I didn't hear the questions well, so clearly. So can you repeat the questions?
Sure, and it's also in the Q&A. The question for you is, what do you think accounts for the increase in safety ratings despite the conflicts remaining steady for the study schools in Hanoi?
Okay. So about the case of Hanoi, actually, we have like the internal discussions about the case of Hanoi. We can see like the star rating in Hanoi increased from like we have two schools per cluster, and in Hanoi we have 2 schools. And when we did the TCT and the star rating for school together at the same time, so as you like the star rating for school is to evaluate the infrastructure related risk of the road in front of the school in the school zones. And for Hanoi, we can see like the star rating increase from 2 to 4 star, while the traffic conflict rate still remain the same before and after interventions. And when after discussion, we can see like for star rating for school, we can see that like when there is we have the sidewalk in Hanoi, in the school zone in Hanoi, we have the sidewalk, and we did like different interventions to reset the speed limit over there. And then we did like different modification at the school zones. That's why, according to the IRAP star rating for school guide, all of those modifications can help to improve to reduce the risk, the traffic risk in the school zones. But in fact, there are some, how to say, there are some factors contributing to the safety of the children when they walk in the school zone. For example, even the sidewalk exists, but in the case of Hanoi, it's pretty narrow compared to other like 2 school cluster. And despite of like the exit, the availability of the sidewalk, but it's too narrow. That's why sometimes the students still need to go on the road, not on the sidewalk. That's what we could observe. And also we set the speed limit of 30 kilometers per hour, but the operating speed in this area is a little bit higher, still a little bit higher than the speed limit that's set for the school zones. And we can see that like the law enforcement, the regulation enforcement in this area is little poorer than the other areas. And it's due to, it's not, and one of the reasons why there is a poor like enforcement here is because like we have some due to some other like factors, because we didn't really have a really long time to for the law enforcement in this area. We need to get the guy, we need to do the pilot in a pretty short time, and we didn't really have time to do with other activities to increase the law, to improve the law enforcement here. And that's why we can see like the students, when they walk to the school or around the school zones, they still walk on the road, and the vehicles, they still like run really fast. That's why the conflicts in this area, the traffic conflict in this area still remains like the same between before and after the interventions. So that's the reasons why the case of Hanoi is a bit different from the two other provinces.
Thank you. That's really good to understand. I want to go to a really good question by Bella Denzar, who I bet many of you know, and combine it with a question by Martin, because I think you're all going to have some really interesting responses to this. So Bella asks, what advice would you give to a community wanting to implement traffic conflict technique for the first time? And do you think it requires an already active and well-organized road safety program in existence? Or could this technique be used as the start of a new road safety program in a community? And then on top of that, Martin asks a good question, which is, what's your experience in gaining local political authority commitment to responding to the findings of studies? So I would love to start with Berenice for that question, because I know that you have some really good examples from your region. And thank you, Berenice.
Yes, I don't know if you have problem. I respond in Spanish. Okay.
That's what we have interpretation for. If you'd like, go for it.
Thank you. Yeah. Esta parte de trabajar con gobiernos locales ha sido muy importante para nosotros porque realmente hacemos un cambio. Esta cuestión de analizar los conflictos nos permite tener ciertos datos para impulsar y para comprobar que este tipo de intervenciones realmente pueden garantizar la seguridad de niñas y niños en un entorno escolar. De hecho, por ejemplo, en Puebla hubo una situación de un conflicto porque mencionaban que solo estaban colocando volardos sin sentido, pero no entendían cuál era su característica, ¿no? Cuál era su funcionalidad al extender estas áreas para peatones. Entonces, creo que en esta parte sí es muy importante tener el soporte con gobierno para realmente hacer una transformación y que no se quede como unos datos, pues sí, ahí que pueden guardarse y no utilizarse para transformar y mejorar la seguridad vial de las personas. So I think that is all.
Thank you so much, Berenice. Perhaps Simon, you might like to jump in on that as well. Would you like to share your experience?
Absolutely, thank you. Right, so based on our experience, and this is something that I want to point out now, is that of course the traffic culture plays a role in the risk behavior of road users, and this also translates to what we saw when we were training our data collectors. The way they perceived the risks before and after the training was relatively, you could see the difference. And this is something that, of course, going through the toolkit helps to open up some of these very fundamental, the basics of how to identify these risks and all other elements that the toolkit has. And again, to go back to your question, whether a local small organization can eventually use this toolkit and the techniques within it. I think having an existing project that was very, very, very useful for us. For example, Amend, we have been doing these assessments for years, and bringing the toolkit and the techniques. It was very complementary. It complemented what we already had in place. Therefore, for an organization that is starting, I think there are some very basic surveys that they have to be at least familiar with. For example, the speeds, just to gauge on average how the risk that vehicles are imposing or imposing to pedestrians, this could be useful in them starting to eventually use the toolkit. But I think that being the case, for safe, as long as you want to look at the safe school zones and conflict around schools, I think the toolkit itself is, sufficient enough to be used by an organization. But again, I think beyond that, it's important to later on involve for example, the local government officials from the engineering department. That was very useful. And again, this engagement involving the local government officials in the process of doing traffic conflict analysis was quite interesting for us. As I said, we don't have the data around schools showing how many injuries have been sustained or were sustained over a period of time. Now, bringing the conversation that even though the data is missing, but the risks and the exposure are there based on the toolkit, that opened our conversation even further, and it was interesting for the authorities to embrace and actually give the authorities give us the approvals to continue with the infrastructure improvements, putting the speed humps, signs, and the like. So that was such a complementary tool for us.
Thank you, Simon. And going back to the point about how to get this road safety program started with traffic conflict technique, I know you and I talked about the potential of actually involving students. And it's not something that has necessarily been done yet specifically for traffic conflict technique, although ITDP, I know that you involve students in your Vision Zero for Youth work, but that is something that there's a lot of potential for here. And I think that, maybe there will be some of you listening to this webinar who see the way to involve students going forward. And that, tell us, we'd love to know, we'd love to see that scaled up. Danielle, I see you came on screen. Did you want to add to that?
No, I'm just
Okay. Kim asks a very good question. She asked, can I ask the presenters about the required budgets, right? We need to talk about how much this costs. Typically to do a school zone safety pilot in low and middle income countries. This includes the site survey, pre and post data collection, analysis, and the infrastructure improvement itself. That's a big question. It's an important one. Would anybody like to share?
I just answered a question on that on the Q&A on text, but unfortunately we don't have that number for real. But actually, I was actually talking to a colleague of mine about that early in the morning, and I'll try to get it, because at least in the city of Rio, the resources come from different departments, and like the paint, it's one contract, and the human resources implementation comes from another one. So it's quite hard to quantify one single intervention, because given the way they are managed. But I'll try to do it. It's not very expensive, of course. But low budgets are very low here, even if it's not very expensive. Sometimes the quality of the paint is not the best one. There's still lots to be improved in the quality of the materials, especially.
Thank you.
And right,
Simon?
and to expand on that, Natalie, I think I want to put that in different categories. Category number one could be the data collection exercise itself. How many data collectors do you need on the ground to collect the data for how many days? So let's say for our case, we had three different data collectors whom we spent 3 consecutive days on the ground together for about 2 hours, 1 to 2 hours a session in the morning, the rush hour session, and in the afternoon when children are heading back back to their homes, out of the school. So you can put that in the local context, just to know how much would you pay, or how much would you set aside for the data collection exercise. That is because the tools are there. Jennifer, I know you have the forms, you have the the tools to collect the data, which actually are available as part of the tool, available in the public domain, and can be shared with our partners and organizations across the world. But the question, as I said, how much would you allocate for the data collection exercise as category number one? The second part is the interventions. And this is where the biggest chunk of the budget actually goes to, right? So you're talking about once you have identified the potential risks and with your team and the local government officials, you have identified specific interventions that need to be put in place for you to mitigate, to reduce these risks. And that will involve zebra crossings, perhaps walkways, as Daniela said. Now, that's different, but I think the biggest chunk of the budget goes there. And then category number three will be to go back to collect post-implementation data later on, 3 months, 1 month later on, which should be the same as how much was spent during the pre or baseline data collection. So once you have those three categories, I think you can estimate. But for the category 1 and 2, it's not that expensive. And if, for example, it's the government, local authorities who are going to implement the infrastructure improvements, then that is very good, because as an organization, it's always difficult for us to implement these, to come up with these infrastructure improvements around schools, around areas where you have done your analysis. But if the government or a certain partner does that, then for the two components, I think it's fairly manageable in my opinion.
Thank you, Simon. And that is unfortunately all the time that we have today, but the conversation does not have to stop here. Again, this toolkit is online, it is free. We want to ensure that all children have a safe and healthy journey to school, which is what they deserve. And this tool is proven to help us get there. So please reach out if you have questions. We hope that you are inspired to try it yourself. And we thank you so much for joining us, and a big thank you to our speakers and their organizations for their hard work in turning this into a reality. Have a wonderful day.